This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Hey, Janet, what are you up to today?
Well, we have a huge party tomorrow. It's our annual chili party, and we have 104 people coming. It's larger than our wedding. So I've already been to Costco in the market, and I'm feeling a little frantic.
Well, I have to tell you, I got some bad news yesterday. One of my, I've been retired for 4 years now, and one of my 18-year-old feline cat patients passed away. And I still keep in touch with a lot of my clients. And, so it was so nice of you to ask our guest today, Katherine Velez, to be on the show, because I think we all have suffered the loss of a pet and we just don't know what to do, and I'm sure there's not one right thing to do for everyone. So I'm anxious to see, to run this by Katherine and get her views on it. But first, I want to tell everyone a little bit about her. She's a clinical social worker in Connecticut. She has worked in nonprofits and in research. She provides emotional support to pet parents. She discusses quality of life issues and also runs a pet loss support group, as well as providing emotional support to the staff. And as a veterinarian, I can tell you, we are the number one medical profession right now for suicides. So I really, really want to welcome Katherine today. She went to undergrad at UCONN and got her master's at Fordham. And I just thank you so much, Katherine, for joining us today.
Thank you. I'm so excited to be here.
Well, Katherine and I worked together. We worked with humans initially, a lot of homeless immigrants, people who were really needed help. And that's how our offices were side by side. And Katherine, being a huge, huge pet lover and owner, when she got the job at Cornell, I just knew it was the right place for her. So, Katherine, can you tell us a little bit more about, what do you do for someone, a friend who's lost a pet?
Yeah. And like you said, it's not like one size fits all, right? So we all grieve differently. We all cope differently. But yeah, I think we're realizing that pet loss is such a huge part of our lives, as animal lovers and pet owners. And it's something that's not necessarily always acknowledged, right? Like we have these big ceremonies and ways of memorializing our family when we lose them, our loved ones, our human, people. But we don't necessarily do that for our animals, and we don't get that same acknowledgement for our animals. And they're probably just as big, if not more, of a part of our lives than some of the people that we lose. So I hear a lot of I lost my grandfather last year, and it didn't even hit me as hard as this, So I think just acknowledging, right, a lot of the pain and the huge loss that we get when we lose a pet, but also being supported by our family and friends and finding ways to memorialize our pets is a huge deal. I always talk about that with my clients. Think about we have funerals and masses and all of these different ways of memorializing our humans, and we don't necessarily do that for our pets. So what can we do, right? And I think it is becoming more, people are becoming more aware of this, and there is sort of ways to memorialize your pets more now, even things like taking the ashes and making them into jewelry, having little memorial services, planting something for your animal in their behalf. any way that you can celebrate and memorialize your pet, it's a way of processing. So you want to be able to process sort of that grief and the pain. And any way you can do that is a good way to do it. Journaling about your loss. I sometimes give out a little letter, like a template of a letter for children that says, like, what would you say to your pet if they were here today? If you could say to them one more thing or write them a goodbye letter, whatever, works for you.
Catherine, I have to tell you a story. I've always thought that my close friends and my veterinary colleagues, when I've lost a pet, and I don't have children, human children, so and I adopt older pets, so you know what I'm going through every 3, 4, 5 years. And it's almost like you expect those people to say, I'm sorry and everything. But to me, the thing that meant the most was with someone I didn't even know. After we had a dog euthanized due to cancer, we just didn't, my husband and I didn't even know what to do with ourselves. We were walking around aimlessly. So he said, well, you want to get something to eat? So, okay. So we go into Panera. And, the girl says, well, would you like an apple or the bread, the little whatever that's called, as a
Oh,
side?
baguette. Yeah.
Baguette, thank you. Baguette as a side. And my husband started crying and he walked away. And I could see that this 16-year-old person waiting on us was like horrified. And I said, you don't get it. I said, we just lost our dog and we always used to give the baguette to her. And, she bought us our lunch. And that meant more to
Oh,
me. I get teary thinking about it. That 16-year-old girl or 18-year-old girl, whatever she was, waiting on us, that meant more to me than all the letters and flowers and everything I got because
wow.
I didn't even know her, but she felt my pain. And I don't know if
Mhm.
you see that, but it just someone you don't expect to hear from. And then they're thinking of you. And I thought, wow, how nice of them. So that's my story.
Yeah, I see a lot of that in the pet support group, right? Pet loss support group, where like a couple weeks ago, we had somebody just like break down, right? And
Oh,
the other
oh,
members of the support group are like, oh my gosh, like I feel your pain. I'm right here with you. Like I
yeah.
wish we could give you a hug. And that element of support is why the group works, right?
Mm.
Because there's camaraderie in sort of being able to be empathetic to that kind of loss and pain and feeling validated like, yeah, it's okay that I'm a sobbing mess right now. This is part of it, and some days you're going to be a sobbing mess and some days you're going to remember your pet and smile or laugh because they used to remind you of something funny that they did. And that's kind of how grief works overall, right? You go up and down, and some days it's good and some days it's bad. But yeah, I think that support from other people is huge, and just acknowledgement. Like, people who love animals understand. If you talk to any animal lover and
Mhm.
you say, oh, I just lost my pet, they're going to tell you a
Mm.
story about how they lost their pet, or
Yeah.
empathize with you or support you and feel bad, so you'll get a lot of that camaraderie from the pet loss community.
I remember when we lost a dog. He was 4 years old, and each of our kids had a dog, a golden retriever, and it was really troubling. And I think Henry was maybe 10 or 11. And our friend came over and she brought a giant bag of Lay's potato chips and that homemade, I call it the pajama party dip, the onion soup mix dip.
Mhm.
And it was the comfort food. And she brought a little stuffed golden for Henry. And I will never forget that. I actually saw her in the parking lot. This is now
Mm.
like 15 years later. I saw her in the grocery store the other day and I said, I'll never forget when you brought over that comfort food. And it was
Oh,
just a thoughtful gesture that she was thinking of us, and it was very unique. So, Catherine, when you talk to pet parents, or when any of us, I know there's the stages of grief, right? And
Mhm.
everyone goes through them differently. But what are things that like you shouldn't say,
Oh, that's a good one, right? So, like,
right?
oh, it was just a dog.
mm,
I hear that a lot.
Oh,
Yeah. Oh, you can get another one. Or sometimes oh, they're probably better off. Like, don't say that. It's like,
mhm, mhm,
there are ways of, like, the whole better off thing, right? So sometimes
mhm,
it's like, yeah, maybe they were old and in
mhm,
pain and they're not suffering anymore. So what I usually say is like, think of this as your last gift to them that you gave them. You brought them peace, right? You brought them to a place where they're no longer suffering.
Right.
But to say like, oh, you're better off, and just, it's going to be fine, or, sort of those comments that are like underlying, sort of making it not, you're not acknowledging, right, the real pain that's there. And a lot of times it's not meant to be that way, but people don't also know what to say, right? They get uncomfortable. They're
That's
like, oh,
Yeah. I think you really find out a lot about the character of a person that makes a comment like that, you know?
yeah,
Yeah.
yeah,
My part of it as a veterinarian is then you start to question, and it's true for me too, what if I didn't have the surgery? What if I said, let's have the surgery? It's always, did I do the right thing? And it's Monday morning quarterback. You look back, well, maybe I shouldn't have done that surgery. He wouldn't have died post-op. But then if I didn't do the surgery, the tumor would have burst. And I feel for people because even as a doctor, I still think about my one that I lost a year ago, thinking, well, maybe that bloody diarrhea, maybe that was something else. And I know in my heart that wasn't. But
right.
it's always what if.
So that's actually in psychology, they call that a hindsight bias,
Mm,
right? The idea that you could have, should have, would have, right? Like
yes.
we could have done this or we could have done that. And I get a lot of clients, coming in like, if I'd known that he was going to be sick, or if I, is it something I did or didn't do? And that's also very much a normal part of grieving, and it's part of our brain's sort of reaction to the pain. I think of it also as distraction, right? So if you're distracted by what I could have done or what I should have done, then you're not thinking about the pain,
Mhm,
right? And you're not
mhm.
processing your grief. So I also see distraction in clients with anger, right? Anger is a great distraction. Well,
Oh,
that veterinarian didn't know what they were doing. It was their fault. Or
yeah.
that bill, I shouldn't have to pay this bill because my pet died. And, we
Yes.
get all of these I call it distraction, but it's really like, response to the grief and a
Mhm.
way for our brain to kind of like protect us from it. Because you also have to think of our brain of like, our brain is trying to protect us, not make us feel happy, right? Like, so it's like tricking ourselves, right?
Mhm.
Hindsight bias is something that I educate clients a lot about because there's always a lot of that. And the other thing that I learned from being in this position is that animals will not show you their pain because
Right.
innately, right, in the wild and
Right.
whenever,
Right.
you know, prehistoric times, you can't show your weakness in a group the way
Mhm.
they would be attacked or killed or whatever. They're still very much like that. So a lot of these animals coming in are, perfectly fine one day. They
Yeah.
come in and
Yeah.
they've got cancer all over their bodies, or there's a tumor, there's
Right.
something terrible going on, and their owners say, but she was fine yesterday.
Yeah.
I don't, what happened? Like
Yeah.
she was jumping around, or she was eating fine, or I had no idea, and how could this be? So that's also something I educate clients a lot
Mhm.
about, just of animals. If you see like your cat's hide, right? So
Mhm.
cats run
Yeah.
away.
Yeah.
Um, dogs, also tend to sort of like keep to themselves. But you can tell these kind of interesting behaviors, and they can't say, I'm in pain, this hurts,
Right.
or, but they definitely show it. I even sometimes hand out a pain scale with little pictures of the
Yeah.
animals because
Yeah.
to us, like in plain sight, you might not be able to tell, but, sometimes like cats kind of,
Sure.
squint their eyes
Full
a little
scale.
bit,
Yeah.
miss. Dogs tend to have like a weird posture when they're in pain. So those kinds of things are things we can pick up on. But even with all of that, you never know, right? You never
Mhm.
know. You're a very healthy animal one day, and the next day something's going on.
Yeah.
I bet the people in that pet loss group will be friends forever because they're
I hope.
pouring their soul out to each other, and I bet they'll maintain that friendship forever and be joyful when someone does get a new pet. You know.
Yeah. Yeah, no, they're really, I mean, that's the best part of the group
Oh,
is really seeing that kind of, and they'll email each other like resources. Like one of them last week was sending out a personalized journal of pet
Oh,
letters they bought on Etsy. They're like, "Look, I found this on Etsy that you can,
oh,
write letters to your pet." Or one of our one of our clients had turned their animal into a cartoon on a website. They put the animal's head on like a little cartoon, and he was a cat. And he's like, "Look, I turned, my cat into a cartoon. You guys
oh,
can do this too,
yeah.
and that's the
Oh.
best part.
Do you ever have
So,
clients that you really worry about when
Oh, yeah.
oh,
and how do you handle that? Because I've had a few too that this pet was their whole life and they spent
Mhm.
8 hours a day taking care of this pet and now they woke up that morning and now what do I do with myself? What
Yeah.
do you do in that case?
I really encourage them to look for long-term therapy and help
Mm.
because, I'm very much like a short-term
Yeah, sure,
stopgap.
sure.
But I had one client and I would get on the phone. I would do short, 30-minute sessions with her once a week for a few weeks. And I
Mhm.
would get on, she would just sob the entire time.
Oh
And
god.
she did that for like a month or two. And then she wouldn't join the pet loss group because she said she didn't want to have to think about her dog. She,
Yeah.
in her own words, would say, I put her away as far as I can so she doesn't have to experience the pain, right? So she's in that sort of stage still. And this animal passed a while ago.
Whoa.
oh,
It's not resolving because she's refusing to go there, like to
Mm.
really acknowledge that this is really hurtful. And, she's a single person. This animal was her life, her pet. Um, so she even moved states. She picked up and left.
Really?
So just to get away from where she was, she
wow.
didn't live in her house anymore.
You lost touch
Um,
with her? Or are you still in contact?
I'm in contact with her. I continue, like every once in a while, we'll send her an email like, "Hey, you sure you don't want to join that pet loss group?"
Mm.
Try
Yeah.
to get her to it. And, I think she will eventually come around. But
Mhm.
again, people cope and grieve in different
Yeah.
ways. It all has to do too with like our past experiences, how we grew up, our own
Mhm.
environment. In some families, pain and grief and crying was perfectly okay. In other families, it was not.
Right.
So
Right.
a lot of that affects the way that we react to these
Mm.
situations. And
Hmm.
So I saw on your Instagram, I follow you, and on your Instagram page
Oh.
the other day, you showed a veterinarian out in the hallway, like closing one exam room and then kind of
Yes.
mentally preparing and going into another exam room.
Right.
Yep.
So what do you do with the folks who work at Cornell? How do you teach
Yeah.
them?
We talk a lot about your own personal well-being, your own self-care, right? Because the idea that and also these people go, I feel like a lot of these, our staff goes in not knowing that they're going to have to handle not only their own emotions, but the emotions of this client and everything that's going on in this room, right? They're thinking,
Right.
we're going into this to take care of animals, but you're also going to have to take care of this
Yeah.
Yeah.
human that comes along with this animal, and a lot of them aren't quite equipped to do that. So being able to just like take care of yourself, your own well-being. So I talk a lot about that, like self-care, coping skills, what you can do in your off time away from the hospital so that when you're here, you're
Mhm.
present and you're able to really take on what's really going on. And yeah, like one time, one minute you're going into a room for euthanasia, and then the second, you know, minute you're in a room with like a puppy with a broken leg or something,
Yeah.
that's but, it's sort of like being able to switch that on and off, but
Yeah.
also allow yourself the time to process when it's appropriate. So maybe it's not immediately, but at the end of the day or when you go home, how do
Mhm.
you take care of yourself and help yourself so that you are processing everything that's been going on and not just sort of burying it under there, because that's how burnout and compassion fatigue show up, right?
Mhm.
You
Yeah.
don't pay attention to this stuff, or you're just going, 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 and nobody can really do that. That old term of like can't pour from the empty pitcher thing. So I educate them a lot on that, and just their own mental health. Like go to therapy if you need to, reach out to me and I will help you or whatever. And a lot of our staff are, actively, they have to be sort of active in taking care of themselves and good about that. And some aren't so much. So I work with them a little bit more than the others.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets.
Well, any tips? I know you have your two girls, and I know you lost one of your Westies, right? Not that long ago.
I
So
lost,
any,
yeah, Elizabeth a little while ago, but and we have Grace, who's now 11, and she was diagnosed with a mast cell tumor, had surgery to remove it, had 8 weeks of chemo, was on prednisone, which made her a monster,
Mm-hmm.
um, and has stayed a monster pretty much.
Yeah, yeah,
Those effects don't go away. So, yeah, we just, actually going through it as the caregiver of a sick animal, it was like a whole other ball game. It's like,
yes,
oh, I have no idea, the medication, the appointments, the
yeah.
bringing her in every week, the rechecks, So one recheck, she had a heart murmur.
Mm-hmm.
Another recheck, we found another mass, and I was like,
Mm.
I'm having caregiver burnout over here, guys.
Yeah,
Um, and it's okay to accept that. And I said to the oncologist, I said, don't tell me about the other mass. I don't
Mhm.
think I can handle that right now. We just removed one. If the other one
Yeah,
shows up and it's cancer, we may not treat it, and that's okay.
right,
And sort of knowing assessing your own quality of life, right? What
right.
can you take on, and what can you not, handle?
Mm-hmm.
And yeah, I have two little girls. It's sort of like, am I going to run them through this, circle of like treating this animal that eventually will die, right?
Yeah,
So
yeah,
it sounds terrible, but it's sort of realizing your limits and putting boundaries where you need to. And so I say to them all the time, it's like every day with Grace is a blessing. We're so lucky to have her. She's
yeah,
healthy, not she's all good. But we don't know. It might come back. Her cancer might come
right,
back, and then we have
right.
to reassess at that time.
You know,
I think that's great that you're honest with your daughters.
Oh,
Because you told me that I remember when the dog got cancer, and I was like, gosh, how's she going to tell the little ones?
yeah.
mm,
Yeah,
But
and
I think it's great that you're
they
honest.
would come like to treatments. They would bring her, and we would talk about it. And this is also how like we built. They might have an animal when they grow up. They're going to lose people when they grow up. So it's sort
right.
of models that behavior for them. Like how do you grieve and deal with these kinds of things. So
That's
How do
great.
you counsel the pet owner that there's no longer quality of life in that pet, but they want to do everything they can, which I'm not opposed to that. But when there
mhm.
is no hope and it's terminal and it's the pet is really just suffering now. They need to let go. And I think what they want is to go, if the dog or cat is at home or it's in the ICU, they want to go to bed that night and have it die naturally in its sleep. But is that really that natural when it could be more of a gift? Euthanasia could be a gift for that pet.
Yeah, yeah, that is really hard, and that's some of the toughest cases.
Mm-hmm.
Um, in the hospital that we're in, it is very much a specialty hospital, so there are all the treatments, right?
Right.
I always say to clients, you can throw all of veterinary medicine at an animal, but it's really up to them and,
Yeah.
how they handle it, and look at your pet, remember when your pet was happy and healthy and was able to play and do all those normal things, and when was the last time they were really able to do that, and that's when we talk about quality of life. I even give them like a little calendar, and I'm like, go home and write down the days that they had a good day, the day that they were able to play ball, the day they were able to you know do the normal things. I've had to put down an 18-year-old,
Mm-hmm.
and it was my boyfriend's dog.
Mhm.
And I literally had to say, like, this is no longer the
Right.
Snoopy that we loved. And, we like, I mean, we still love him, but, he
Sure.
wasn't able to do things he loves to do. He loved to swim and he loved to go to the beach and he can
Uh,
barely stand,
yeah.
now.
Oh,
So,
Yeah.
you have to, and euthanasia is a gift. It
Yes.
is a
Yes.
gift.
Yeah.
I say that to clients, to be
Yeah.
able to end the pain and suffering of your animal is a gift for them. Maybe not, for us, because we are going to miss them and we're going to have a huge loss because of it. But for them, it is a gift.
I remember when I was in vet school and I was working ICU, and there was a border collie. And when border collies get epilepsy, it's hard to control them. They're just they just, the blood brain barrier is different. And anyway, it's called a P glycoprotein deficiency. But I remember it was my first day on ICU, and I went back to school when I was 31. So I thought about stuff. I mean, I wasn't a little 22-year-old that was a robot and did what I was told. So in ICU, we had to turn this dog every 2 hours. It was on, like a giant mattress heating pad type thing. And it was just a body. And I remember turning it, and I looked up at my instructor and said, "Have the owners seen this dog? Because just because you can do something doesn't mean you should." And then, of
Yeah.
course, I went off that service and I never knew what happened, but it just didn't seem like quality of life to me.
Yeah. Yeah. And yeah, the idea, I've had clients say, like, oh, I want them to die naturally, or,
Hmm.
something, but again, in pain, I mean, do you
Yeah.
want your,
Yeah.
so I've said to clients, like, are you okay with taking your home dog tonight and having them die in the middle of the night?
Right. Right. Yeah.
Are you, going to
Yeah.
be able to do that, because
And
they're
I wonder
reluctant to?
about that, the agonal breaths, and, then they get fecal and urine incontinent. And I don't think it's as peaceful or pretty, if you will,
mm,
as it's
Mhm.
not just sleeping away sometimes. And sometimes they make that sound, where they scream out, especially when they throw
Yeah.
a flat. So, boy, your job's a tough job. It really
Yeah.
is. Yeah.
It is, but it's also really rewarding. Like, of all the jobs I've had in my life, being able to, like, sit in a euthanasia with a family and to really see them through the process and the pain, um, it's been very eye opening.
Hmm.
Yeah.
I have to say, being in human medicine before I was in veterinary medicine, I love my profession now because I think we're very heartfelt, we're very emotional, um, and I don't see that in human medicine. With the loss of my father, I was with him when he passed away, and I think I've told this story before. And when I called the nurses station and said, "This is Alice Novotny. I think my father has just passed," the nurse came in, and the first comment was, "Well, he was fine when I came on shift." And then the
Yeah.
African American cleaning woman who I would see every day, she would come in very quietly and just kind of give me a little smile, came in and grabbed me in her arms and hugged me.
Mm.
And
Yeah.
that, again, meant everything, which I try to pass on in veterinary medicine because I think that's why the suicide rate for vets is so high. We're going from a euthanasia, like you mentioned, to a puppy jumping all over. That puppy owner doesn't want to hear what I just went through in that other room.
no.
And so we have to compartmentalize that, wipe it up, push it up, and go in there and act like all cheery. And boy, that takes its toll after a while. And
It
that's why I
does.
think there's such a camaraderie in veterinary medicine and such a high suicide rate, because after a while, it's hard to take.
Yeah.
Well, Al, I'll never forget when Daddy he had liver cancer, and so he was the color of a sunflower,
Hmm.
right? Because his liver was shutting down, and
Hmm.
you and I think we were taking him to ER somewhere in Cleveland, and I'm parking the car, and you come out of the room where they checked him in, and you say, "Wait till you see the color of the walls," and it was like the blue behind me
Yeah.
was marigold yellow, the
Yeah.
same color
Yeah.
as the cancer patient, and I
Yeah.
thought, what designer picked this? Like, what were you thinking?
Yeah.
Because he literally blended in, and
Yeah.
it was, I don't know, it's just not very thoughtful, right?
Well, and there
I
is
still
kind of
remember that.
an amusing story, when my dad had cancer of the appendix, actually, that then went to
Mhm.
the colon and then onto the liver 11 years later. And I was a hospital pharmacist at the time, so he had surgery at my hospital. It's a little DO hospital in Akron. And so after that, well, before the surgery, I guess he was having trouble pooping. Okay. So, so we, my dad, he was kind of weak and everything. So my mother comes with us to the appointment and we sit in the exam room and my mother says, Dr. Kazmierski comes in and says, so Mike, Mr. Novotny, I see you've been just passing mucus and not really any stool. And my mother, in all of her Lithuanian craziness, goes, where is all that BM going?
And Alice went
I
like
went,
this.
but think about it. Where was all that BM going? I mean,
It's
seriously,
a logical
because
question.
in old people and in pets, this 21-year-old cat that I have here, that BM stays in there and it gets toxic. You got to it's got to go. So I kind of chuckle about that to this day because in her own crazy, simplistic way, where was all that BM going? And wait, and this
She had
was
a valid
this
point.
was Dr. Kazmierski chewing gum. I don't know.
It's true. It's
So,
true.
I mean,
And
God,
then,
God loved both my parents, but that's the difference between the father who was calm as a cucumber and the mother who was a crazy lunatic.
okay, so wait, then another one was I was pregnant at the time when dad was dying. And I'm in Cleveland, and I was living in California at that time, and I'm in Cleveland, and they take you in the room with the doctors, and they're giving you the bad news, like it's coming to an end, and da 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 da. And then Sue, mom, goes, "What about the baby?" Because I was pregnant. It was like I was on a soap opera. What about the baby? And the doctor's like, "She'll be fine."
Yeah,
Like you know what I
yeah, yeah. I tried to keep her away as much as I possibly could because it was something else. But you gotta sometimes you do find a little humor in the
You
sadness.
have to.
You really have
Yeah.
to. And I know I've laughed through tears and I guess cried through tears and laughing and crying at the same time because people, I don't know, it's like a release, isn't it though? The crying or
Yeah,
the laughing, and I don't know. You know,
Is that a good thing to try and
absolutely. I think humor is a great, I mean, obviously when it's appropriate, but
right?
it's definitely, there's levity in it, right?
Yeah,
Any
yeah.
emotion that will get you going. And laughing is just like, it releases hormones, it gets the brain feeling good. So it's definitely a good strategy when it's appropriate.
yes.
Well, I know when my friend Anne, when her dog was quite elderly, and it had been time for a long time to put that dog down. It had been a while.
Mhm.
And someone said something like this to her. Well, it's about time. It
Oh,
was like the worst thing to say because it's such a big decision to
yeah.
make, right? And it weighs on you. Like I know when I've had to put the cat down, you
Well,
keep thinking about it,
and I
thinking about
think
it,
you're
thinking
right.
about it.
I think, and I think Catherine, you'd agree with this. I think it's a mistake to try to talk somebody out of the decision. When they've made that decision and they
Mm.
made that euthanasia appointment, and the dog maybe is in the end stage of lymphoma, and well, we could try this one, and I think they've already made that. I don't know. If it's if I see there's life there and there's quality of life there, I would say, hey, there is this, because then people will say, why didn't you tell me about that treatment? Why didn't you offer that to
Mm.
me? So it's a fine line between
Yeah,
did I do everything and did I wait? And the big question I get, I'm sure you get it, should I have done it sooner?
right. Yeah.
Yeah.
Yeah, I always just try to say, there's no wrong or right here. Like,
Okay, that's great.
even when we're
That's
presenting
good advice.
euthanasia,
Yeah.
right? So some people have not decided, right? And
Hmm.
it's sort of there's no right or wrong, but you just have to go with what you feel is right in that moment because you're the one that's going to have to live with the consequences, right,
Yeah.
of your decisions. So nobody can really make that decision for you.
And what do you say when a client says, "Well, what do you think I should do?" Or they say that to a doctor, because they're looking for someone to tell
I
them,
tell them
right?
what I would do. And you know what? Before I became a vet, my vet said to me, if you treat them all as if they were your own, you're going to die 1,000 deaths. And I remember
Oh,
saying to my husband, how can I not? How can I not treat them as if they were my own? But I think they're looking to you for your medical advice. Like, is there something I'm
yeah.
missing here? Is there an extra treatment we could do? And you would be wrong to say, well, I can't make that decision. Go home and look it up. That's excuse
Yeah,
my French, a BS answer. They're looking
yeah,
for your guidance, and I'm sure you get that asked all the time, Catherine.
yeah. I do, and I will usually, refer to whatever the veterinarian has recommended, but also I use my own examples. Like
Right.
I've had a couple of different experiences. So I've had a dog where maybe we waited too long, and I've had a dog that died too soon,
Yeah.
Right.
Yeah.
by not by our choice. So I definitely try to just relate to them and say, whatever my experience is, that might be able to help them in their situation. But, I make it clear at the end of the day, it is their decision to make.
What did your recent dog die of? That you said, Janet said you recently lost a dog.
Well, not.
Oh.
She had complications of Lyme. Um,
Oh.
so we didn't know she had Lyme until
Myocarditis or heart disease from
like
it? Or?
Lyme's disease, where she was bit by a tick at some
Oh,
point. We
yeah,
just
so it's probably
don't.
kidneys then. Yeah. Okay. Yeah.
Right. So it had already spread to her kidneys,
Oh,
her
yeah.
organs. We had no idea.
No.
Um, so we treated, but by then it was a little too
Yeah.
late. Yeah.
Yeah.
Until they get dialysis for pets, we're going to lose them from that or leptospirosis. The same thing hits the
Yeah.
kidneys. And
Oh yeah.
humans, you go 3 times a week for dialysis, but dogs, they do it, but it's very expensive and only specialized ICUs do it. Yeah. Oh, I'm sorry to hear that. Yeah.
Mm.
Catherine, you talked about memorializing your pets, and I have to say, when we lost one of our first dogs, our vet sent home. It's like plaster of Paris
Mm-hmm.
with the paw print.
Yeah. Okay. Like a claw. We call it the clay paw print or whatever it's
Yeah,
called.
that thing. And we now have them for each of our pets, and they're really sweet mementos. I wasn't It was completely unexpected, and it came in the mail, and it just was really thoughtful. It actually came about a month later, which for us was a good timing, with little
Yeah.
children and all that. But it was really thoughtful, and I often we have them up on our bookshelf, like our little homage to our pets, and it's just very special.
You know,
Yeah.
Something that small.
our older sister is a librarian, and she sent me Catherine Ryland wrote a book, Dog Heaven and Cat Heaven, and they're
Yep.
Yes.
and I send those to my owners when they lost a pet, and I love it because it's very simplistic, and you can read it to a child. You can read it yourself. And
Yeah.
I personally think the Cat Heaven one is written better than the Dog Heaven one, but I've probably ordered 100 or 200 of those over my career. It's a lovely sentiment, and people refer to it. I've gotten feedback that I love that book you sent. It's just darling. And a friend of mine lost their pet, and I bought that book, and so I need to talk to that author. I
Maybe we can
need
get her on the podcast.
individuals.
Yeah. No, that is a great book. I'm very familiar with. Other thing I always put, so I give out like these pet loss folders, I call them. I don't know. It
Oh,
just has like resources and my information and brochures on grief and pet loss. Is the Rainbow Bridge poem, which
Oh yeah,
everybody loves.
yes.
I've even had
that's a good
a
one.
male client say, he emailed me after the fact. He goes, that Rainbow Bridge poem you sent me, it was a little corny, but it did help.
Oh, 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 that's
Yeah.
so sweet.
Yeah.
I
Well,
bet you have a lot of cute stories because a lot of people say really cute elementary things. We're talking technology all the time. Oh, renal disease and blah blah blah. But it's so comforting to hear it when it's simply said, isn't it? Though, yeah.
Yeah. Yeah. Yeah, I love, getting letters or anything like that. I'll
Mhm.
post for staff to see. Recently, we had a really great success story that went like, viral or whatever, and people would comment underneath the post, on social media, like, "We love Doctor Whoever. We love this one. Thank you
Yeah,
so much." So I blew it up and put it up for the staff to see all the
wonderful.
positive comments.
Yes, that's
Because,
wonderful. Yeah,
those are far and few between, unfortunately.
yeah.
Sometimes you see the negative, right? So, like, of
yeah.
of all the positive, you see one negative comment, you're gonna think about that
I would
negative comment.
dwell on it. Yes, yes. And let me tell you, and I don't know if you're seeing this at the Stamford office, but in our Akron specialty clinic, we've had to call the police a couple of times because people threaten you with a gun.
Mhm,
They'll
Oh
call
my
in,
God.
yeah, say my dog has diarrhea, and the receptionist will ask them a couple questions, and they said I'm going to come and shoot up the place. I mean, it's cray cray now. Yeah.
Yeah.
Ugh.
Definitely gets volatile quickly. We've had like issues with like people posting negative comments about one
Oh,
of our doctors online, where we've had to really like, it was like cyberbullying to the
oh my
extreme.
gosh.
um, we've had just unfortunate sort of client situations, and again, I think a lot of that is distraction, right? Like if
Oh,
I
right, right.
fuss, if I scream and yell about how terrible this doctor is, and I don't have to face the music, right? That
Yeah,
my dog is
yeah.
really sick, or that they've passed away, or
I'm
yeah.
just
Well,
curious.
doesn't the good?
I'm sorry, Jen. I'm just curious. What did the specialty clinic do about that then? Is that prosecutable or no?
It probably was, because like they were
Okay.
even using the doctor's name, and
Oh,
really, yeah,
Oh,
way
okay.
too far. But we have a wonderful marketing woman who would
Mm.
go online and like, she'd scratch off
yeah.
all the comments and have to like, block, hide,
Wow.
do all of the things. And that's really how we handled it. But that doctor was really not,
Oh,
she was
sure. Yeah,
happy.
yeah.
Don't you have a therapy dog? Isn't it a golden at the clinic?
We don't wait.
Oh,
So Stanford Health got a golden therapy
Wow.
dog, and then one of our staff members got a golden, who lives in my office because I've just
Oh, that's okay.
okay.
so but I would love for him to be a therapy dog. He's just one, so he's a little bit crazy still,
Oh, yeah.
and he's also mixed. So he's just a crazy boy right now. But I do think he would be a great therapy
Yeah,
dog. His name is
yeah,
Bram, and
He's
he's just
adorable. I've seen him
I
on
love.
your social media. He's
yeah.
Yeah,
cute.
Oh, that's
he's the
cute.
best. Goldens are
Well,
just the best.
well, Catherine, we ask all of our guests this.
Oh, boy.
What is your, or putting you on the spot,
Yes.
what is your pet peeve? And it can be a human peeve or a pet peeve. Hmm.
Pet peeve. I don't know if I have a pet peeve with pets, but with humans, I
Right.
hate loud chewers. Very, people who chew loudly, or like who
Oh,
chew gum, chew their food loud.
Oh,
Yeah, or
yeah.
with their mouth open. No, I don't want to see them. Like I don't want to. I use this word a lot. Masticate. Like I don't
yes.
want you
Yeah.
masticating your food. I don't need to see
Somehow
that.
it's cute when a dog or a cat does
Oh,
it,
it's so
but
cute
when
Yes.
the
when they chew
human
a
does it, you're
potato
like,
chip. Yeah.
oh,
Yeah. Absolutely.
that's a good one. That's a really good one. That's a good one.
Well, I can't thank you enough. This has been so lovely. I
Thank you.
I feel like I want to hug her. It's
Oh, thank
well,
you. I want to hug you all too.
I was watching Jeopardy last night, and now it's the champions, and so they all three know each other. And every show afterwards, they go into a group hug, and I'm just like get all teary eyed. So I found here's a group hug.
Group hug. Group hug. I love it
Group hug.
Yeah.
so much.
Catherine, thank you so much.
Oh, you're
I
so
will see you
welcome.
at Minx to, I'll see you at Minx to Sinks.
Yes, that's coming up soon. It was so
I know
nice to meet
Catherine
you.
Oh,
volunteers, and that's
thank you again. We love you.
thank you,
Thank you,
Catherine.
sir.
You're awesome.
Bye.
Thank
Bye.
you. Hey, Al, we have a question from a
Yeah.
listener. It's on our
Uh-huh.
Facebook page.
Oh, I saw that, and it's a dermatology
Oh,
question.
yay.
So, okay, the problem is we have a year and a half old golden retriever that is on Apoquel, which is a medicine for allergy. That when he's on the Apoquel, he doesn't chew his feet. But after the Apoquel is discontinued, he goes back to chewing his feet. So I wanted to address that. First of all,
Wait, I have a
we know that
question.
golden.
What does Apoquel
Yeah,
do to the dog?
yeah, well, it's something called a Janus kinase
Oh,
inhibitor,
gee.
which aren't you glad you asked? And it prevents there's something called cytokines that promote itch. And so
Oh,
it prevents that. It
okay.
blocks the cytokine that
Kind
promotes
of like
itch. Okay.
topical hydrocortisone for a human.
Yeah, but it's not steroid.
Okay.
That's the advantage of it.
Okay.
It's not steroid. And it has been revolutionary in treating pets' allergies because before that, these pets were living a life of cortisone, which is not a
Not
good
a
thing.
good thing.
Okay, so we have a year and a half old golden. So that dog could have environmental allergies. That's why he could be chewing his feet. Okay. He could be food allergic chewing his feet. However, Apoquel usually doesn't do much for a food allergy. Apoquel is pretty short acting. So as soon as you take the dog off of it, it's going to go back to chewing if it's being used in an environmentally allergic dog. But there's two other reasons why they can chew their feet from a dermatology point of view. One is in a young dog like that, it could have a mite called Demodex,
Oh,
which is cigar shaped and lives in each little pore of the feet. And so the veterinarian should scrape the feet looking for Demodex, okay? And if that's negative, that's a rule out. So cross that off the list. The other one could be you want to check for a bacterial infection of the foot, okay?
Oh.
Bacterial or yeast. Sometimes if you look at your dog's nail beds, there'll be like a waxy discharge there.
Ew.
Well, any kind of discharge, dermatologists love. We love pus, we love discharge, we like anything.
Dr.
We put it under
Pimple
the microscope.
Popper.
Yes, exactly. We do that. We put it under the microscope, and if there's yeast there, the body sets up an allergic reaction to yeast. So Apoquel would work for that, but it's not going to be a long-lasting thing. So if it is yeast in those nail beds, they need to use an anti-yeast drug. So, okay, we're going to scrape the feet looking for that mite. We're going to check the nail beds, no yeast there. Then that dog probably needs to be worked up for environmental allergies, skin tested or allergy tested, because in a year-round foot chewing issue like that, where Apoquel helps, it's probably dust mite allergic, because that's the only thing that's year round. Ragweed pollen comes and goes. Spring tree pollen comes and goes.
Right.
So my advice to that owner would be, let's see your vet for skin scraping of the feet. Let's check the nail beds at the vet for yeast. If both of those are negative, then you need to talk environmental allergies.
Speaking of,
So thank you for the question. It's an excellent question, because a lot allergy, foot chewing or foot licking to me is allergy till proven otherwise. And in order to diagnose allergy, I had to rule out those other two things I talked to you about, the yeast and the mite. And that's what a veterinarian would do. So see a vet. Also, if you want to see a veterinary dermatologist, you can go on our college website, ACVD, American College Veterinary Dermatology.org, and click on Find a Dermatologist.
Oh, that's cool. Speaking of pus and discharge, growing up, you were always really into popping pimples and zits.
Yes, I was.
You were a picker and a digger.
I love dermatology. Dermatology is very visual. And, I hate surgery. We're going to have a surgeon on pretty soon in the next week or so. And in surgery, they used to call me, "Where's Alice?" Because they wanted me to close, because I'm a good sewer. And I was so happy when the surgery was over, because remember, the blood and the organs need to stay in the body.
Yeah.
Okay.
And you know why we're good sewers?
Miss Hastings.
Miss Hastings. And I even taught, my whole family says,
Shore Junior High School.
Clean as you go, girls. Clean as you go, girls. And that's the best tip ever from our home ec teacher. So bring us your questions, because that was a good one, Allison, right up your dermatology and allergy aisle, or alley, however they say it. So send us an email to contact@speakingofpetspod.com. And don't forget those super cute pictures of your pets, because we'll feature some of those. And your own pet peeve, be it human or pet oriented. We'd love to hear from you.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.